Tell you 1, 2, 3.
1, 2, 3.
My doctor is telling me that I may need surgery for my sciatica.
Yes.
Do I?
Sometimes, no doubt. If the sciatica, which is it's actually the largest nerve in the body, if that nerve is so compromised from the spine that it is causing specific signs and symptoms, you may very well be a candidate for surgery. Specifically, is the patient losing motor function? Is the size of the leg getting smaller because the nerve energy is being inhibited from the damage to the sciatic nerve from the spine? This is mark one up for surgery. Is the pain intractable? Not only is it a quality of life issue, and pain is very subjective, but is it intractable pain where the patient can't function? That mark another one up for surgery. Does the patient have loss of sensation in the leg or the extremity or the foot, or is there a loss of circulation because the nerve controls or influences the amount of blood in the leg? So these are things that you need to consider in a surgical intervention. That said, did you try conservative management of it? All of the guidelines call for, interestingly enough, manipulation and anti-inflammatories that you need to absolutely have in collaboration with your medical doctor. So the best answer is, yes, you may be a candidate for surgery. However, you must try all conservative methods first, including physical therapy, manipulation, anti-inflammatories. Think about your diet. If you have a high inflammatory diet, you're creating an environment that is conducive for degradation of tissue, of nerve tissue. And are you active or not active? Your lifestyle. These are issues that all go in, but sometimes, yes, you need surgery. I find that if the patient has tried conservative methods for treatment and they failed, the surgery has a higher level of probability that it's going to be successful. If you went to the surgery before you tried the conservative methods, and this is anecdotal, but I suspect you'd see that a higher incidence of poor outcomes for surgery.
Do adjustments cause strokes?
No. No.
But answer that fully for me.
Okay, so the American Heart Association concluded there is no causal relationship between manipulation of the neck and stroke. The American Stroke Association concluded there is no causative relationship between manipulation of the neck and stroke. The National Institutes of Health Center for Complementary and Integrative Medicine, Integrative Healthcare, concluded it is safe and no causative relationship to stroke. That said, and the final analysis, money. The malpractice insurance company that insures chiropractors across the country concluded there is no causative relationship to stroke for manipulation and therefore no reason to change the premium, no risk. So that all sounds really good and it sounds like I've got a nice neat package for that answer, but here's the real question. What is the risk-benefit ratio of the procedure as it relates to neck pain and headaches? That's the question that has to be asked, because if we looked at, and we'll go back to previous discussions about conservative management, if a patient is taking an anti-inflammatory, the risk of an adverse event for an anti-inflammatory is markedly higher than the risk of having a stroke as a result of manipulation, which is very, very low. So if you only go to the medical doctor, your primary care, you have neck pain or some type of a headache, and we determine that there is not a red flag, we've discerned that there is no medical emergency, and you start on a course of anti-inflammatory without other conservative measures like manipulation, you've driven the risk higher. You introduce manipulation, you've reduced the risk because you've reduced the amount of medication you're going to use, because the manipulation does in fact have a positive effect on treating neck pain and certain types of headaches. So herein lies the issue. What's the risk? What's the benefit? What's the best way to approach it? Integrative medicine is the best way to approach it, where the physician is working with the chiropractor, because what we see is the least amount of pharmacological intervention when you have chiropractic included in the treatment.